Hello, it is now 1 p.m. Eastern Time. You have joined the orientation webinar for the fiscal year 2021 SCA Improving Substance Use Disorder Treatment Program Kickoff. To allow additional sign-ins past the hour, we will start this webinar in a few minutes. Also, for support or any other technical issues that you are experiencing, please refer to the chat. There are messages there, and we'll be happy to assist you in connecting today. Hello, everyone joining. We're still just trying to give it one more minute or so to allow additional sign-ins. Know that sometimes people have technical issues. Also, if you're experiencing any kind of technical issues, please refer to the chat. There's a message there about some of the assistance we can offer if you're having any tech issues. Okay, so let's go ahead and get started. A lot to cover during this time today. Good afternoon, everyone. Thank you for joining today's orientation webinar for fiscal 2021 Second Chance Act Improving Substance Use Disorder Treatment Service grantees. My name is Alexis Lacey. I'm a project manager at the Council State Government's Justice Center, and I will be the moderator for today's webinar. Let's move on to the next slide. Today, I'm joined by Meg Chapman, who's the policy advisor with the Bureau of Justice Assistance. Meg has spent over 25 years working in a variety of social science research, policy development, and analysis and program evaluation roles. In 2021, she joined the Department of Justice Office of Justice Programs, Bureau of Justice Assistance, as a policy advisor supporting the Corrections, Reentry, and Justice Reform Policy Office. Her portfolio of work is focused on the intersection of behavioral health and corrections and includes informing policy related to the identification of individuals with behavioral health disorders at the point of detainment, the assessment and provision of evidence-based treatment to individuals while in custody, and continuation of care upon release. Prior to joining the Bureau of Justice Assistance, she spent over 20 years with ABT Associates Incorporated, a global consulting and research firm, where she managed and executed numerous research studies for federal and non-federal clients. Ms. Chapman received her Master's of Arts in Criminal Justice from the State University of New York at Albany. I'm also joined by Jennifer Lewis, State Policy Advisor for the Second Chance Act Innovative Reentry Initiatives, Bureau of Justice Assistance, Office of Justice Programs at the U.S. Department of Justice. Jennifer has been with the Office of Justice Programs, U.S. Department of Justice since 2006. She currently serves as a grant management specialist for the Bureau of Justice Assistance Programs Office. In this role, she manages and provides guidance in the administration of Second Chance Act grant funding. Also today, I'm joined by Kim Richard, who has enjoyed a long career in human services. Her primary focus has been in various modalities, providing services to individuals suffering from substance use disorders. In 2015, Kim assumed the role of Project Director of Stephanie Stone's Offender Reentry Department, providing oversight for 3 grants specifically targeted to assist justice-involved individuals in Southeastern Massachusetts and Cape Cod. She has 2 adult children and will be becoming will experience becoming a first-time grandmother this Thursday. Also, we're joined by Lisa Costa, who has been working with justice-involved individuals for most of her career. She's worked in both residential and outpatient settings, providing frontline treatment and reentry case management services with great skill. She is a full-time student and a mother of 4 children. She enjoys warm weather and relaxing by the beach. Last, we're joined by Sarah Wurzburg, Deputy Program Director in Behavioral Health Division here at the Justice Center. To give an overview of today's webinar, we will do introductions to the Bureau of Justice Assistance and the Justice Center. Then we will provide more information on improving substance use disorder treatment services grant program. Then we'll talk about the planning and implementation guide and the technical assistance process. After that, we will hear from a grantee about their experience, followed by information about post-award grant management. At the end, we will have time for questions and answers. At any time during the webinar, you can use the chat box function at the lower right-hand corner of your screen. We'll keep a running list of questions, and at the end, we'll do our best to get through as many questions as we can, and we can follow up by email for questions that were not addressed during the webinar. Next slide. And now I'll turn things over to Meg Chapman, who will talk more about the Bureau of Justice Assistance.
Hello, everyone. First, congratulations on your award. So exciting. And as was mentioned by Alexis, I am going to provide a bit of a background on BJA that might be new to some of you or just a refresher for others. Next slide. So the Bureau of Justice Assistance is located within the Office of Justice Programs, or OJP, and OJP provides a wide range of services to the criminal justice community in the form of grants, training, technical assistance, and research. Although our focus today is on BJA, there are other OJP offices shown on this slide that serve as DOJ's statistical and research arm, as well as those that offer additional grants and programs to support our shared public safety missions. The COPS Office and the Office on Violence Against Women are 2 other DOJ components that provide important resources for the criminal justice community. Next slide. And so BJA itself is focused on providing leadership and services in grant administration and criminal justice policy development to support local, state, tribal law enforcement in achieving safer communities, and through grants to state, local, tribal governments and community-based agencies. Next slide. So the Second Chance Act, which provided the funding and support of the program you received your award with, is funding to reduce recidivism and improve outcomes for youth and adults leaving detention and incarceration to return to their communities. And the act was signed into law in 2008 and was reauthorized in 2018. And so since then, we've been supporting, as I said, state, local, and tribal governments and nonprofits, and have awarded over $500 million in grants to develop and implement and test strategies. So Next slide. Through SCA funds, BJ hopes to provide communities with funds to implement new programs or scale up existing programs. And we support these efforts through training and technical assistance that is informed by existing evidence and best practice and designed to assist grantees through the life cycle of their grants. I'm going to introduce in the next slide is that you are all also supported by the National Reentry Resource Center, also referred to as the NRRC. And that's a collaborative project of BJA and the Office of Juvenile Justice and Delinquency Prevention to advance the knowledge base of the reentry field. So this means supporting agencies and organizations like yours, criminal justice agencies that are in a position to prepare people for or supervise people in reentry, and community-based organizations who provide services and support to people in reentry, as well as individuals seeking information about where and how to find such support. The NRC also serves, the NRRC, it's a tough acronym sometimes, also serves as a convener and coordinator of SCA grantees. And if you have not heard already, the NRC is also hosting Second Chance Month, which is a month-long event in April that will host over 30 webinars for the field, along with other resources. You may have already received an email from the NRC encouraging you to register, but if you haven't or you have not yet, please visit www.buildsecondchances.org to see the lineup of events and join us for as many events as you are interested in. You are also being invited to a grantee-specific event that will be hosted by CSG Justice Center, but this is through the NRC is also, so there's kind of two tracks. One is grantee-specific sessions, and then others that are open to the field, which cover a range of topics related to behavioral health, family support, youth and young adults, employment, education, housing, evaluation and sustainability, as well as just other topics that are important to making reentry work. So if you haven't already visited, again, it's www.buildsecondchances.org. So I really encourage you to visit that site and see what both live events and resources will be available. And as I said, that the event starts April 1st and will be going the whole month of April. So plenty of opportunity to join. Next slide. So today I personally am excited to get to know all of you. I'm relatively new to BJA, so you are my inaugural cohort of SCA grantees that I will be having the pleasure of working with from start to finish. So I'm really excited to be here today and to hear about your work and your planned activities through this grant. So there's 7 of you, and we're the funding organization, and the Council of State Governments Justice Center will be your training and technical assistance provider. So each sort of group, or we call them program track of grantees, has may have a shared, but we have 3 training and technical assistance providers. CSG is one of them, and they provide the training and technical assistance to your grant pool, as well as others. And then, as I mentioned, the National Reentry Resource Center, which is hosted by another Second Chance Act training and technical assistance provider, American Institutes for Research, or AIR, is also that sort of umbrella entity where all resources related to reentry are available for you all to take advantage of. So I'm throwing out some acronyms that you may hear and also some agencies, but the important distinction is the Natural Reentry Resource Center is that umbrella organization over all reentry activities, and the Council of State Governments Justice Center is your grantee-specific training and technical assistance provider. Next slide. And I think as with that introduction, you'll get to know a little bit more about CSG.
Thanks so much, Meg. Yes, so at the Council of State Governments Justice Center, we're very excited to be the Second Chance Act training and technical assistance provider for behavioral health programs, housing, and family supports. So through this, we really try to assist throughout the planning and implementation processes. So you'll have a TA coach from our team reaching out to you, but we try to just advise and provide experience based upon working with current sites and sites we've worked with previously around the country to help you think through how to best support project management for these programs, the planning, the implementation. We're also able to connect you with experts and resources in the field as well. Next slide. So for the way we do our technical assistance is we kind of have 4 different prongs. So we have a TA coach who will be the main point of contact, and they're going to be helpful in directing you to all the resources. If you have a question, you can ask them. And if they're not the right person, they'll tell you if you have to go to Meg or Jennifer or someone else from the Bureau of Justice Assistance for the answers as well. We try to do a lot of peer-to-peer learning opportunities. So times for you to get together with colleagues who might be in this cohort of the fiscal year 21 grantees or some older cohort grantees as well to talk about some of the issues and some of the challenges you may be facing. We have access to experts, so both internally at the Council of State Governments Justice Center, but also we have some sub-awardees who are able to bring to bear some of their experiences on a variety of topics. So whether it be medication-assisted treatment in correctional facilities or telehealth or enhancing your peer recovery support services, lots of different people we can connect you with to provide some additional expertise. And then we also work to develop resources and tools. So oftentimes when we're working with grantees, we may hear certain questions that are coming up across a lot of different programs. So then based on that, we would actually work to develop a tool or resource, whether it be a short 2-page document to explain, to answer some of the questions for people, or a longer tool that might develop more extensively to really support it. So the goal is to really listen to everything we're learning from the sites and be able to develop things that'll be responsive to your needs. And also we share a lot of resources that we've developed, the National Reentry Resource Center and others in the field that we may be aware of. Next slide. So your technical assistance coach or your TA provider is really the air traffic controller of the group. So they will have monthly calls with you. They will support the deliverables. So really going through the planning process and the planning and implementation guide with you. They're here to share resources. So let's say you want to do a mental health screening tool and you don't know where to look for that. They could provide you with some examples of commonly used ones, some that might be low cost or no cost as well. They'll help with the peer learning opportunities. So we'll have learning sessions for you that will be learning communities where you can connect with other sites from your year and other years. And then we also are able to do on-site visits. So historically, those are often in person, and we hope that we'll get back to that soon. But in the past couple of years, those have also been virtual. So we're not able to visit every site, but we try to do it based on needs. So if there are some specific issues where we think some on-site support could be helpful, we'll work to try to visit you in person to do some type of training or more intensive support. Next slide. And now we actually have a poll for you. So have you previously received a BJA award? And there's a yes, no there. And then if so, have you previously received a Second Chance Act grant? So just trying to get a feel for how many of you have had this previous experience before. So we'll leave this open for just a couple of seconds to give you all a chance to respond, but it's always good to see how many people have the experience with BJA grants, because you may have other grants that you've had before, like Substance Abuse and Mental Health Services Administration, but those are often, they have different requirements. So everything is always a new learning curve. We saw in the chat that someone asked, will the slides be shared? Absolutely, we'll share the slides, and we're also recording this, so it'll be available if you had a team member that couldn't make it. All right, are we able to close the poll and see the results? Okay, so 30% of you said that you've had the award before, had a BJA award before, but only one of you actually indicated that that was a Second Chance Act award. So I think we have a lot of people who are new to the Second Chance Act grant world. So everyone on this call is committed to helping guide you through these processes. I'm gonna turn it back to Alexis as we go to the next slide.
Thanks, Sarah. Now we're going to talk a little bit more about the grant program. So next slide. The Second Chance Act, which was passed in 2008, supports units of government in reducing recidivism and improving outcomes for people leaving incarceration and returning to their communities. The Second Chance Act Improving Substance Use Disorder Treatment Services Award has supported over $89 million in reentry investments across the country. These investments include 143 grants to state, local, and tribal entities. Next slide. Now, during this time, we would like to introduce the FY21 Second Chance Act Improving Substance Use Disorder Treatment Services grantees. And so what I'm going to do is I'm going to give you an opportunity actually to introduce yourself and also share who else is joining your team. So it would be one person from each grant site would basically introduce the entire team and talk a little bit about why you apply for the in addition to what the scope of your project is very briefly. So I'm going to actually just do a roll call and call off beginning with the Concordance Academy of Leadership in Missouri. What we would like you to do is just raise your hand and then we can invite you to speak and you can just say who you are and who's on from your team and just tell a little bit about your grant project. Let's get folks from Concordance Academy of Leadership, just a second, see if we got any hands raised. Shelby.
Hi, can you all hear me?
Yep. Hi.
Yeah, so we're Concordance Academy out of St. Louis. It's just me on the call right now today, but we've got our full team behind us. And we are a comprehensive reentry program serving the St. Louis region. So we work with people 6 months pre-release and then up to a year post-release with wraparound services that include substance use treatment, some housing support, case management, behavioral health services, and legal help, things like that. And so we're excited. Yeah, we applied. So this will cover offering our full program for the year and expanding our class sizes to serve even more people.
Okay, thank you, Shelby. So happy to have you on. So the next one is Detroit Recovery Project. I know I saw one name from Detroit. Let's see, got a hand raised. Is that Julia Felton from Detroit?
It's Julia, Canzoni, and Angela. Can you hear me?
Yes. Hi, Canzoni.
Oh, okay. I can't see the button here, so technology. Dr. Canzoni Asabiji, I'm Vice President at Detroit Recovery Project. We've been in existence since 2005. We were spun off from the Detroit Health Department after successfully completing a SAMHSA grant for recovery support services. And right now we are a CCBHC, so we provide substance use disorder services, mental health, and primary care services. A lot of our clients, majority of them are returning citizens. And so it was a really good fit. And we know the challenges that they face in the community. So we, just saw this opportunity and just couldn't resist. And we're really appreciative that, BJA awarded us this grant. So we're looking to do good things in our community and looking forward to the resources that you provide us and to reduce recidivism and also to allow a lot of people, to be integrated back into the community. So what we do see here, one of our challenges is that most often when people are returning from the prisons, from our experience, they give them a one-way ticket to Detroit. So, we face this challenge to make sure that people reach their destinations. And so we're looking forward to working with you. So on the team here, I think we have Angela, Burton, Dr. Julia Felton, who is our evaluator. We have Sireya Lee and Reynaldo Bowles, who will be the core team working on this project. Thank you.
Okay, all right, thank you. So moving on to Guadalupe, Puerto Rico. One from there, okay. Helen Ross McNabb in Tennessee. Little Dixie Community Action Agency in Oklahoma. Oh, somebody just raised their hand. Dion.
Hi.
Mika.
Can you hear me?
Hi, which agency?
So we're with Little Dixie Community Action Agency. Actually,
Okay.
we're Lift Community Action Agency now, but we were Little Dixie, so we've just changed our name. So, and
Great.
I'm sorry if you can barely hear me. I'm having some microphone difficulties, so I apologize.
We hear you.
Oh, you can. Okay, good. Yeah, so Little Dixie Community Action Agency, or Lift Community Action Agency, we're going to be trying to improve substance abuse services and support for adults with substance use disorder. Our program is going to be a pre and post-release service to inmates and formerly incarcerated individuals. We have a tri-county area, so there's going to be 3 counties that we'll be serving. And we just want to improve the case management, the cognitive behavioral therapy and counseling, and other services throughout the tri-county area. We're a small community, so we all kind of know one another, but unfortunately we don't always work well with one another. And that's what we're hoping to improve for our offenders. So, and we're excited.
Thank you so much. Okay, so then we also have Renika from Helen Ross McNabb. Hope I pronounced your name right.
Hi, good afternoon. I'm Renika Greenlee, and I'm with the McNabb Center. I'm over the Jail to Work program here in Morristown, Tennessee. The Jail to Work program began in 2017, and the program helps promote the recovery of women who have substance disorder and are involved in the criminal justice system. We applied for the grant to be able to continue to address the needs of the criminal justice population by providing female inmates with intensive outpatient therapy for substance use disorders. We provide them with individual therapy and counseling, relapse prevention, communication, work skills. One of the curriculums that we use is Getting It Right and Courage to Change. And this grant will be able to help with the treatment portion, with substance use treatment, medicated assisted treatment, mental health therapy, and then we hope to serve 120 incarcerated women over the 3-year period. So our overall goal is to reduce recidivism and increase community tenure through work, transitional housing, recovery, and integrating them back into the community. So I look forward to working with you all of the resources that you all provide so that we're able to help improve the lives of the females that we serve. Thank you all.
Thank you so much. Okay, the next one is Pinebrook Family Answers in Pennsylvania. Is that Lori Van Doren?
Hello, can you hear me?
Yes.
Hi, so I'm Lori Van Doren. I'm the Director of Forensic Services at Pinebrook Family Answers. Pinebrook's a pretty big agency. We do anything from outpatient behavioral mental health to adoption and foster care and even elder care services. But in forensics, we focus on reentry. So we work in 3 different local counties. This is actually our second Chance Act grant, and this project focuses on women. It's trauma-based, and we use all evidence-based programming, starting with the women inside the jail and then continuing outside of the jail with case management and reentry services. So we're excited to be working with you.
Thank you so much. Last but not least is Polk County, Florida. Mary Beth Moore.
How about that? Can you hear me?
Yep.
Good. Mary Beth Moore, I'm the Forensic Program Manager here in Polk County. I have on the call with me Sarah Campbell. She's our Grant and Project Specialist, as well as Judy Tewksbury. She's our Finance person. We all work under the Health and Human Services for Polk County. But we're excited that the grant we received is going to expand our Helping Hands program. And we've been in existence since 2018. We started. It's a jail reentry program for those that have mental illness that are inside our Polk County Jail. And what we've learned is there's a huge need for medication-assisted treatment in our jail. It's not only wanted, it's needed in our county. So with this grant, we're able to expand our program to serve not only the men and the women that are in our jail. And then when they're released, of course, they'll continue their MAT treatment, and we're able to wrap around supports of peer specialists, case management. And then the uniqueness of our program is we utilize community paramedics as well. So we're excited to start this venture. And right now we had to do a request for proposal. So that was just posted this week. So we're looking forward to the process happening and starting up, changing lives in our community.
Great. Thank you so much. Okay, so I appreciate everyone for joining the webinar today and introducing your programs to us. I think that's all. So now I'm going to turn it over to Meg.
Hello again. Thank you for sharing your programs. And because you applied and were successful, you're likely to be familiar with what I'm going to share, which is just a recap of the program objectives for this grant program, which is really, primary focus is improving the provision of substance use disorder treatment to people in prisons and jails and through the reentry process, including during any period of parole or court supervision, if applicable, but really to start that process pre-release with standardized screening and assessment tools that informs comprehensive case plans and evidence-based treatment and other services, both, as I said, starting pre and then moving into post-release. And there is some call out for prison-based programs to really to meet some of our administration priorities related to providing family treatment programs for incarcerated parents of minor children or pregnant women. You might have also noticed that another priority of this administration is to really expand medication assisted treatment for individuals with substance use disorders in facilities. So happy to hear that that's a component of some of your all's programs. Next slide. And there's two, if you recall, there's two important points. I mean, the whole project's important, but there's some important points where you are going to be working closely with your TA provider and your program and policy staff, me included, on hitting specific milestones. So one important milestone is as an action plan, there is, when we award you, we give you $100,000 and we're with a guidepost of a 6-month period to work closely with us and in this, your training and technical assistance provider, in this case, CSG, to put together a program and implementation plan. And while that may sound daunting, you have an excellent team available to you via CSG, who has been working with grantees. You're all unique and different, but like you, to put together these plans in a successful plan and then work with you over the life cycle of the grant to implement those plans. So that's kind of, just a point that we have embedded into this program is a requirement to, in order to get the rest of your funds, to first hit this milestone where you develop the plan and then we approve it and then you're, free to move forward. But this is an important point that we've put into this grant program so that we can, you develop a solicitation, things change. There's only so much detail you can put in your response to that solicitation. I think I said develop a solicitation. What I meant was develop a response to a solicitation, but there's only so much detail you can put in there. So this is an opportunity to really kind of get in the weeds with you and make sure that we're supporting you and setting you up for success. And then at the end of the grant is a report out on, the process, your achievements, the outcomes that you realized as a result of the grant project. And that's just really helpful for us to know how the grant funds were used and as I said, what outcomes were realized as a result of the investment. And then also, efforts to sustain and hopefully scale up your program. So next slide. And then this is just, the different, we've talked, thank you for sharing each of you on the different, plans that you have to use the grant funds, but, you can see the overriding theme, which is to support individuals prior to reentry, to screen and assess them, identify their needs, provide evidence-based services to support their successful reentry and to ultimately reduce recidivism and public safety. And so some of that is, like I talked about, medication assisted treatment or other treatment within the facility that extends and continues upon release. I've already mentioned the emphasis on prison-based programs that do support parents of minor children and or pregnant women. And just as I said, doing that comprehensive screening and assessment and case planning and case management to really support people who are, experiencing long-term substance use disorders that, and to, provide them supports to be successful upon reentering their communities. So, so that's kind of the recap of the solicitation. And as you all know, there were 36 months awards, and the really important initial point is to work closely with us to develop that plan so that we can move forward, release the rest of your funds, and see you succeed. And then I'm turning it back over to, I don't know if it's Alexis or Sarah.
Sarah.
Oh.
Okay, so getting started with your grant award. Next slide, please. So Meg went over some of this, but we have the action plan is also actually what we call planning and implementation guide. So people will use those words interchangeably. So the requirement that says action plan is the planning and implementation guide. So just want to make sure we're all really clear on that, because it does get confusing with a lot of different language being thrown around. But we do have an updated version of that the TA coach will be able to share with you. The goal is to work with you on this over the next 6 months. And this will really help you be set up. So when you move to implementation, things hopefully go really go really well. And so once the P&I guide is submitted, it goes to our colleagues here at BJA, so Meg and Jennifer. And then Jennifer is able to release the withholding conditions. So then after that, you would have access to the rest of your funds. But the TA coach will walk you through this whole process. So on these monthly calls, we'll be going over all that information with you. Next slide. So we have different sections, and really it's meant to think about what is the planning process that one could go through for this. So the first section is really just about getting started and revisiting the goals that you had laid out in the proposal, checking if those still make sense, if it's still the same, if there have been changes. And we know particularly with COVID-19, there have often been a lot of changes lately. So just we'll keep that in mind as we work through it. Also, as a part of this grant, there's people put together an advisory group. This could be a reentry council, a behavioral health justice council that may already exist, and then your implementation team, who's really focused on moving the project forward as the key people doing the work as well. The second section is really about the target population. So a lot of this comes down to who are you going to serve? How many people can you serve? And what does that look like based upon the needs in your community? So this will really go into the details about who's eligible for your program, or if you have exclusionary criteria, who might not be eligible, and walk through your screening and assessment process, which is so important just to start that identification process. Next slide. The next session is really, what are you going to do with the people you're working with? So looking at the evidence-informed services and support. So is there different curricula that you might be using for your substance use treatment or other recovery support services? Is there other things that you need to consider to make sure you're engaging people in the programming and services? So really looking at what are the core things that you're doing as part of this program, both pre-release and when people are in the community. Then the fourth section is on collaborative comprehensive case plans and post-release support. So really thinking about how you take that substance use and the criminal justice information and put it into a case plan that makes sense, which can be difficult to do because it's a lot of information. And then what people are actually getting once they're released in the community to create a continuity for hopefully what was provided within the correctional facility too. Next slide. And then the next section is about data collection and performance measurement. So there are some required performance measurements from the Department of Justice called the Performance Measurement Tool, or PMT. And it's really, how can you collect that, but also other measures that might be most important to your stakeholders, whether it be the head of your behavioral health agency, maybe the sheriff or the head of your jail, and other people, to make sure that you're getting the information you would need to know if the program's effective and hopefully move you towards being able to sustain the program too. We'll work with you to develop a logic model as a part of this, which is meant to just really break down that data collection into something that's easily digestible. Next slide. So this is an example of the logic model. So really thinking through, what are your goals? What are some of the resources and the grant is providing? The timeline for this, the output or process measures. So getting back to what you're actually collecting, and then the outcomes you're looking to collect. Next slide. Then the next session is planning for sustainability. So even though it feels like you just got this grant, the couple-year period often will go by really quickly once you're done actually implementing the grant. And so we like to think about sustainability from day one, because the things that you put in place now will hopefully help you maintain funding after the life of this Second Chance Act grant. Next slide. And then the last section is really about just identifying technical assistance goals. So based upon the process, what are some issues that maybe had come up that you would want additional support on? You could be implementing a new program or new intervention, and you might want additional support in that, or it could be topics that you're interested in expanding on. And then after all this is done, it'll be submitted to BJA as we had discussed. And now we'll turn it over to Kim and Lisa from Stepping Stone, who are going to talk a little bit about their experience.
Good afternoon and congratulations to all. I'm very honored to be here to share with you both myself and Lisa's experience with this process. As was mentioned earlier, and I hear a lot of grantees have similar experience with other grants, and this grant for us was a way to enhance our offender reentry department. And I decided to bring Lisa along with me because this is really her brainchild. She was a lead case manager on our Project ROAR grant, which was funded by and is funded by SAMHSA. We've been working with Bristol County House of Correction since 2012 with that SAMHSA grant, and we're now in our third round of funding with that grant, and it's called Project ROAR here at Stepping Stone. And like was mentioned, like Sarah talked about, it has different criteria than this one does. And one of the criteria is that folks had to be sentenced. And so that meant a lot of folks who they had to be sentenced for a certain period of time. And so that meant a lot of folks were unable to connect with us to receive case management services. And Lisa works on the front lines in case management with offender reentry department, providing case management services. And she began to see a lot of folks getting out of the House of Correction without even hearing about the additional support that was available to them. And even if they did hear about it, they weren't able to qualify once they were released from jail. This was disturbing to her. And when I was sitting at my home office during the height of COVID, the development director reached out to me and asked, Kim, there's this great opportunity through the DOJ to provide additional reentry services to folks that need it. What are your thoughts? I immediately reached out to Lisa and we talked a little bit about, it seemed like so long ago, talked about what she sees as a need being in the front lines. And she told me a little bit more about that. And I partnered with the development department here at Stepping Stone to kind of develop our proposal. And we were awarded in 2020. And then we began our planning and implementation process. So we have partnered with the Bristol County Sheriff's Office and parole. I'm here to share real-time, real-life experience. So when it comes to this slide, I'm going to be honest about what it means to build relationships with criminal justice stakeholders. It takes patience and persistence and positivity. I could keep going with the P's, but and so having already established relationships with Bristol County and parole, because some of our offender reentry services do take place right at the parole office. So we're blessed in that way. We had a real healthy infrastructure when it came to implementing this grant and rolling it out. But we still have a little ways to go in our implementation when it comes to relationships with people at parole. Probation, excuse me. We do follow, and we did follow critical time intervention model without even knowing it. But now we have a more formal definition of that, and we do follow that. So our in-facility treatment groups have not yet taken place, only because of access to the jails being what they are in a post-COVID world, but we'll get there. Could I have the next slide, please? So one of the things about this grant that was most attractive to us was the idea that we could bring, like some other grantees mentioned, MAT into the mix. So we do have a mental health provider on our team, exclusively targeted to just meet the needs, the mental health needs and the MAT needs of our clients here on the Bristol County Reentry Project grant. And so it's been extremely gratifying, not only to meet with TA, to begin planning, the planning and implementation guide, but also to see that come to life, to see what we wrote down in that guide over a period of time come into play in real time. It's been extremely gratifying to see that happen. And we have been able to improve in our reentry programming, the ability or shorten the gap between substance abuse, reentry, and getting substance abuse treatment and mental health needs addressed. So that's been our biggest success thus far. We've started taking clients in December of 2021. We now have 13 clients on our roster. So we're extremely excited about rolling this project out to the other programs, I'm sorry, I'm nervous. Rolling out these programs to our folks inside the House of Correction and also at the probation office. We've already rolled it out in parole. And one of the things about having TA assistance through this funder, it's made us look at things in a way that we wouldn't look at otherwise. So when you work with a grant or a funder over a period of time, you almost become complacent and you just do what you do. It becomes rote and we do it. But having come into this, this experience using TA, and it's forced me to think outside the box and think in a different way. But it's also, as a result of having permission to be able to do that, it's also improved the services we've already had in place. So I loved my technical assistance experience, and I'm not just saying that because it made me excited about the possibilities above and beyond what we were already providing. And I think that TA gave me the support to be able to kind of venture out of my comfort zone and think about things in a way that's different. It helped me become more creative and innovative, and my team as well. And so I do have Lisa here, and I didn't want to hog the whole time, but she's going to speak a little bit about her experience providing case management to this population on this particular grant for just a few minutes. So Lisa.
Okay. Hello, everybody. Good afternoon. I'm an integrated care facilitator for the Bristol County Reentry Project, and I've been with Stepping Stone for a little under 5 years now. And this experience, I was on the Project Roar for about 3.5 years until I transitioned to this grant. But it's been a great experience because it's put me in a different category of individuals that I'm able to serve. And working with individuals from all walks of life, it's been a little bit different and it's been great. So I can think of one individual with the critical time intervention model who is an elderly individual who's on parole for life. And my experience in dealing with him since December, he was actually our first client, I believe. And the care, I could see like the critical time intervention model working in his life and in our relationship because of the care, type of care that he needs, whether it be medical treatment or mental health counseling or whatever his necessities are. So being able to see that come to fruition and how it's actually working in his life is, it's been a great experience because I can take that piece and I can carry it on to the rest of the individuals that I have to serve. But, you know, working with individuals with mental health and the need for MAT and being able to obtain those wraparound services within a week's period of time of their release, or just them becoming a client of ours has also been beneficial because sometimes I know, you know, from my past experience and not having that as an opportunity, there's like a month or two, sometimes individuals are waiting to be seen by a psychiatrist or a mental health professional or an MAT provider. And I think that the time frame of turnaround from when we submit the referral has been extremely helpful to being able to make sure that these individuals get the proper treatment that they need. I know one of our biggest barriers is the employment and the housing opportunities, but I can tell you experience I've had, especially with this individual who's on parole for life and the nature of his crimes and what he's committed, but I'm able to advocate for him and get him the proper help that he needs and find the options that he may have and not just make it an automatic no that he's going to be turned away. And I'm learning a lot about the housing opportunities and how the advocating piece is so vital to working with these individuals, because a lot of the time these individuals will think that it's an automatic no because they have a Corey background or because of the nature of their crimes. But being able to advocate for these people has, I've been able to see receive some better responses in those areas. But yeah, I don't know. That's about all I have to say. Kim pretty much summed it up and did a wonderful job on her presentation on how this grant has rolled out. And I'm grateful to be a part of it.
And we're grateful to have Lisa. She's been the lead case manager, helping out her coworkers too is extremely helpful. So I don't know what else to add, except for please embrace and enjoy the technical assistance you receive. Because for me, it's made me I feel I've grown professionally as a result of the TA stuff, because I'm giving myself permission to think in more creative ways than what I was used to. It's forced me to think differently, and I'm enjoying that. That ability to be able to do that. And it's kind of breathed new life into offender reentry here at Stepping Stone. Because as you know, it can get a little old after a while. To have a new opportunity is always a great thing, to stay engaged. So that's it. That's it from New Bedford, Massachusetts. Nice to meet you all.
Thank you, Kim. Thank you, Lisa. We really appreciate your presentation on your experience with receiving technical assistance and the glowing review. We really appreciate that. So now I'm actually going to turn it over to Jennifer Lewis to talk more about post-grant management and federal compliance.
Thanks, Alexis. Excuse me. And welcome, everyone. It's so great to hear from you all. I'm Jennifer Lewis again, from the BJA Programs Office. I'm pretty much your go-to for all things grant management and just grants related. And today I'm going to quickly go over some of the post-award requirements. Next slide. Just an overview of what I'll cover today: special conditions, reporting, required trainings, procurement subawards, subrecipient monitoring, FAPIS reporting, grant award and modifications, or GAMs, grant monitoring compliance, and additional information and resources. Next slide. So special conditions is pretty much any placed on your award at the time of application. Please pay specific attention to the special withholding conditions that might require you to provide any missing documents that were not submitted at the time of application, or incomplete documents that we need additional information on specific to this award. Next slide. So this is just a sample screenshot of what your award will look like in Just Grants. Please pay attention to that red circle where it's the begin button. This allows you to navigate through Just Grants and make any changes to the award. I think a lot of times people forget to click the begin button, so just make sure that you pay attention to that. Next slide. So this is a screenshot of where your award conditions are located. It's not shown here, but you may have to slide to the right to find out which conditions are specific to the withholdings. It'll indicate as such that the special condition hasn't been met. Obviously, I'll work with you to release those withholdings, and then eventually those conditions will show up as cleared in the system. Next slide. Okay, and here's where I discussed about the different types of withholdings. You have additional withholdings, which are standard conditions that are placed on your award, placed on all of the BJA awards as standard. And then you'll have your planning and implementation guide or action plan requirement. That's a specific withholding that's placed on your award to complete, as discussed earlier. And then just work with me and helping to resolve those withholdings. If you're not sure if you have any withholdings, feel free to reach out to me. Again, I'll work with you on releasing those. And just wanted to note that the withholding special condition does prevent you from expending or obligating or drawing down the funds. So please make sure you address those. And then once it's all clear, then you'll have access to funding in the ASAP system. Next slide. So progress reports are to be completed in Just Grants semi-annually. And please note that if your report is overdue, you'll have an automatic withholding placed on the award. Then once it's submitted, then the withholding will be released. And progress reports are to be completed by the grant award administrator role. Next slide. You're also required to submit federal financial reports in Just Grants on a quarterly basis, and here we provide you with the dates. And then you want to note that if your report, again, is overdue, there'll be an automatic withholding placed on the award, but once you submit it, the withholding will be released. And financial reports are to be completed by the financial manager user role. So please make sure that the contacts in Just Grants are current and up to date. Next slide, please. So as part of your special conditions of the award, the grant award administrator and the financial manager listed in Just Grants must complete the grants management financial training online within 120 days of acceptance. And recertification is every 3 years. And we've provided you with the link here. Next slide. So for subaward and procurement contracts, there are different requirements for subawards versus procurement. Specifically with subrecipients, if the contract or agreement includes like activities that would be categorized as carrying out the purpose of the federal award, then it's considered a sub-award and therefore subject to subrecipient requirements. So even though your agency might identify the third party as like a contract, BJA might consider it as a subrecipient, but feel free to contact me if you have any questions regarding that as part of your budget. Next slide. So if your grant includes subrecipients, you're required to monitor them. And here are some of the key components for effective subrecipient monitoring. So make sure that your agreement specifies and requires progress and financial reporting, as well as non-compliant penalties and termination procedures. Monitoring, you'll need actual monitoring policies and procedures written as part of your policies. And then an at-risk based monitoring for selecting which subrecipients you plan to monitor, either annually, quarterly, or how your agency performs those tasks. And also a process for on-site monitoring, whether it's conducted through a site visit or conducted through enhanced desk review. And that should include like a report or checklist that satisfies the administrative, financial, and programmatic elements, pretty much documenting any findings that you see in your subrecipient and how to resolve those issues. Next slide. So federal financial reporting requirements, sorry. It's a long word. It's Federal Funding Accountability and Transparency Act is what we call the FADA subaward reporting system. So if you do have subrecipients over 25,000, you're required to report in this system. This is to be completed at the end of the month following subaward finalization. We provided you the links here. Next slide. Grant award modifications, or GAMs. This is really important. This is used to request any changes or corrections in your award, and the GAMs are to be submitted by the grant award administrator role. And some of the grant award modifications might include budget modifications, change of scope, project period extension, sole source approvals over 25,000, and programmatic cost approval. So any changes that are over 10% of the total budget, you would need to submit a programmatic GAM for approval. And just to note that you must be current on both financial and programmatic requirements in order for you to get the GAM approved. So make sure that you are current with reporting. Next slide. And just to note that BJ does conduct formal monitoring activities for our grantees. This is in the form of a site visit or a desk review. This is to ensure that you're conducting activities that were proposed and approved, meeting the programmatic, administrative, and financial requirements, identifying and resolving any issues that we've come across, and receiving the necessary technical assistance and training regarding the Just Grant system. Slide. Yep, and that concludes my portion of the presentation, and I think I'll hand it back over to Alexis, I believe.
Thank you so much, Jennifer. So now that we've wrapped up our presentation portion, we're going to turn to the Q&A. So next slide. Oh, I'm sorry. Actually, for the to-do list, I apologize. So you will want to contact the BJA programs and budget clearance about budget clearance, set up your monthly call with your TTA provider. So we should be in contact with you all, someone from CSG Justice Center, to actually set up those first calls. Following that, you'll want to also review the FY21 solicitation and your proposal, just to make sure that things align and understand what the requirements are. Complete the action plan, which is your P&I guide that we went over as well. You'll have assistance on that from your TA coach. And then sign up for the OJP, BJA trainings, and including Second Chance Month. So we'll have field-wide trainings on lived experience on April 5th, cultural responsibility on April 12th, and connections to care on April 26th. In addition to a 2-day convening, which will take place April 21st and 22nd, you all will receive information about this from your technical assistance coach as well. Next slide. Now it's time for questions and answers. We did receive some questions already, so I'm going to actually start with those and post them to, I think the first one I have, or actually I'm going to post to Meg. And the first one came in, it was about sharing how Do you know how many applications were reviewed under the substance use track of the 2021 solicitation to reach the final number of 7 grantees?
I was not here during that process, and so I'm apologize to say that I don't know that off the top of my head. I don't know if Jennifer does, but it's something I can get back to you on if I'm able to share that information or have it handy.
Great.
I don't know, Jennifer, do you know? I'm not sure.
No, I don't have that information, but usually it is posted on our website under the solicitation. I'm not sure if it is this year though.
Okay.
I'm sorry, for last year.
So we'll follow up about that. The next question we got in was, we are in the process of upgrading our electronic health record, EHR. Does this grant allow for infrastructure development, including costs associated with an EHR?
Jennifer, I don't know if you have a ready answer for that. I would say 2 things. One is, I don't know if that cost was already in your proposal. So if it wasn't, then that would be something you would submit to Jennifer and I, and, sort of what the cost is, because that would require a change. And Jennifer already mentioned the grant adjustment modifications, GAMs. That would require a change, but importantly, it would be an assessment on our end as to the nexus to the program and how it supports your grant. Jennifer, did you want to add anything to that? Oh, go ahead.
Yeah, sorry. So as long as it ties back within the relationship of the solicitation and meeting the goals and objectives, then yes, you can request a modification. If it wasn't already approved as part of the budget, you would submit a budget modification GAM in the system to include an updated budget narrative worksheet, and then we'll review it.
All right, thanks, Jennifer. And Meg, so the next question we had was, where can you find the P&I guide? So I'll actually answer that. The P&I guide will be provided to you by your TA coach. So your TA coach should be in contact with you via email to schedule your first call. During their call, they will also provide you with a copy of the P&I guide and explain it in more detail. The next question we had is for Kim and Lisa. Are there any first steps you would recommend for a new grantee?
So I would recommend that you get familiar with your continuum, and that you get familiar with your community and the service providers and start building those relationships. If for me, it was really important to get familiar with my continuum, get familiar with the folks who work in the outpatient department, talk to other providers under the Stepping Stone umbrella about just how is providing MAT services to this criminal justice population going to look, and how can we work together to make that happen? That's just one example. Another example of collaboration would be with our data entry person. So when we have performance measures that we have to report on, it's important to just like someone just talked about the electronic medical records, just how are we going to collect this information? And really, my data analyst and myself really bonded, got to know each other a lot better once we began working on performance measures and how to collect that. So it's like an all hands on deck kind of situation to kind of bring your solicitation to life. And I think that's what I would recommend the most, is just build those relationships, call in the experts if you don't know yourself, ask questions during when you don't have the answers through your technical advisors, and they give you suggestions as well. So just really being open to new and different ideas and different approaches to things.
Thank you, Kim. Okay, so we have another question for Jennifer. How do we know if our budget is approved?
You should have received an email from Just Grants indicating that the budget has been approved. If not, you can always follow up with me and I'll double check in the system.
Okay. One other question. Did our project period begin already? Is the GAMS needed to move that back while awaiting the budget clearance and other planning steps?
So the project period on your award document starts in October. So October of 2021, right? So it's already started. However, you still need to wait until the budget is approved before you can start anything. So just make sure you reach out to me if you're unsure about your budget before beginning planning.
Great. So like Jennifer said, the time for completing the guide is after the budget is approved. So just keep that in mind. Your technical assistance coach will go over that with you when they have their first call, but definitely wanted to mention that as well. Are there any other questions? Also, if you wanted to, type it in the chat, or you can use the Q&A function as well. Doesn't look like we have any other questions. Before we close today, is there anything else, Meg or Jennifer?
No, just thank you for attending. We are excited to have you as part of the Second Chance community. Do join Second Chance Month, but just also know that, and I think Kim and Lisa did a great job reinforcing that CSG Justice Center, Jennifer, myself, we're all here to support you. And we know, especially for those who might be new to the Second Chance Act grant, there's requirements, and we're here to help you get through those. And especially the program and implementation guide is really there to help you and support you, and to just promote your success. So we look forward to working with you. You have a great team to support you, and we look forward to continuing to see you build out your programs.
Thank you so much. So let's move right along. All right, here are the points of contact information. So you have both myself and Sarah's information for training and technical assistance here at CSG Justice Center. And then you also have contact information for BJA, Meg Chapman, Jennifer Lewis, and for your PMT reports, the help desk information as well. Next slide. And we just want to thank you for joining the webinar today. Also, we would like you to subscribe to the CSG Justice Center newsletter. We look forward to working with you. This webinar will be recorded, has been recorded, and will be posted to our website, as well as shared along with the slides from today. Thank you so much, and have a good rest of your day.
Thank you, everyone. Bye-bye.